The member for South West Coast.
Thank you, Deputy Speaker, and I rise today to speak on the Health Legislation Amendment Quality and Safety Bill 2021. But before I begin, I would like to acknowledge the hard-working health professionals who have been working absolutely under enormous pressure in a system that's not well funded, but I'll get into that in a minute, and putting them into extraordinary circumstances. I'm very lucky to know many of the nurses who work very hard across South West Coast, my electorate, particularly at South West Healthcare, where I trained. And I'd like to acknowledge today that in Queen's Hall is one of my friends who I trained with, Katie Asling, an exceptional nurse who has both theatre training and midwifery training under her belt. And Katie and I, as I say, trained together, and it's been interesting listening to the stories of my colleagues. And thanks, Katie, for the hard work you've been doing. I know you did 12 hours in a PPE, which is hot in any circumstances, and swabbed my son and my daughter-in-law, and throughout the last 12 months, and just spent 3 weeks in the COVID intensive care ward at Warrnambool Base or South West Healthcare. So you're one of many that I'd like to thank and acknowledge. She's sitting out there with a couple of my dairy colleagues, so I better acknowledge Rod and Leslie Sheen as well. But I think it's really important that we acknowledge the hard work of the health professionals. And this bill is a health bill that actually does a few things, but I'm going to highlight 2 things. And the first one is the bill permits the Secretary of the Department of Health to appoint a Chief Quality and Safety Officer. This new officer will be responsible for conducting quality, safety reviews of health and ambulance services, and these reviews will focus on systemic issues rather than the individual fault. Now, the question I ask is this bill an admission that the policies and procedures in place at health services right now are insufficient to deal with patient treatment problems? So, the question really is, why is a Chief Quality and Safety Officer needed? Now, I would suggest that if we look at the Productivity Commission's report that highlighted just this week that we, as a state of Victoria, are the most underfunded health state anywhere in this nation. So we have the least health funding per capita, per patient, than any other state. And this is not because of the pandemic. This, according to the Productivity Commission, began long before the pandemic. So we've got a Premier who was a Health Minister for 3 years and then became the Premier. So he knows very intricately the health system, and he knows that he hasn't done his job. Yes, we absolutely are in a pandemic, and yes, we need to have treatment and we need to do things differently than we did 2 years ago. But the reason the health system is under pressure is because of the mismanagement of this government. And I back that up with the statement, if we had had the 4,000 ICU beds when they were promised to us, we would not have the waiting lists that we have today from surgery, because many of those surgeries can't be done because you have to have sometimes on ICU backup, and there's just not the capacity because we haven't had that promise delivered on. So I will move on now to the second point I want to highlight in this bill, and it's about the ability for the health organisation, doctors and the like, to be able to, when we've had an incident, and these do happen because nothing's perfect, that the doctor or the health organisation, the hospital, are able to issue an apology to the person without compromising themselves, without fear of incriminating themselves. And I actually think this is very important. When people go through a health situation, it's a really, really vulnerable time in your life. And if something goes wrong, or you believe something's gone wrong, and people go to ground and don't actually give you a decent explanation, it's very, very hard for people to process and move to an acceptance stage and work with what the problem has left them with, or the problem has made them, some people might lose someone, a family member, or they might actually, I've seen it many, many times, and people just find it very, very disturbing. So I actually think this is really good, and I think it's really important. It's psychologically important to have an apology when you deserve one. So I think it's really a good segue to talk about the apology that's needed to go from the Premier and the Health Minister and the Labor state government to the 801 families who lost loved ones at the start of the pandemic as a result of the failure of this government to recognise that you do not put people in charge of quarantine who have no infection control training. I mean, really? That's the most basic thing. I do know. I do know why they did it. It was all about giving jobs to the boys. What on earth was this government thinking? And 801 people died. So that's one of the first apologies that might hopefully happen. And what about apologising to all the people now who are on a waiting list? 80,000 people on waiting lists for vital elective surgery. And, you know, it's not just the people on waiting lists, because that's going to grow. It's going to be 1,000 next week on top of that, and another 1,000 by Easter will be 90,000. I actually worry about the people who have put off things and aren't on a waiting list. You know, there's people that have a colonoscopy every 2 years. They've thought, oh, you know, I can't go to the doctor, we're being told not to do that. It's, you know, oh, there's other people out there more important than me, I'll be fine. And lo and behold, I'm really worried about the fact that they won't be. And instead of having a polyp that was precancerous, they get told they've got stage 3 cancer, and, you know, they begin their chemotherapy and they begin their bowel resection and whatever treatment has to happen, and their life is more than likely severely shortened. And that's really not good. I spoke to a very esteemed gentleman from my part of the world just last week, one of our senior clinicians, senior physician, and I said this to him. He said, we're already seeing it, Roma. And he told me about a lady who, you know, she got seen by telehealth because she thought she had sciatica. And you can't really examine a patient really well. Telehealth is good, but you need to go in, and the doctors, you know, weren't able to do that. So she saw someone for her sciatica, which turned out to be a primary osteosarcoma in her hip, and by the time this fellow saw her, she had a fungating cancer in her breast. That means the cancer broke through the skin and was oozing a revolting wound from her breast. You don't see that anymore. I saw that years ago. You don't see that anymore. We're seeing things again that we shouldn't be seeing. And I think about all the men in the country who it's been so goddamn hard to train them to get to see doctors, to prioritise their health, to address their, attend to their prostates before they have a problem that's, you know, untreatable. That's so important. That's been a really big campaign. Well, I can guarantee you most of the farmers I know would have put that off. And we will see so many cancers that we won't be able to treat. I just can't not mention either this callous decision that the government made about the IVF, putting in vitro fertilisation treatments on hold. These women have little chance, these families have a little window to be able to have these babies, and the government did not think, obviously, because they said it was about resources. But the minute the community went into an uproar, they reversed it. So it was all about politics. Because if it was about resources, which they said it was because they didn't have enough nurses, we found out all the nurses had been put on holidays and their decision was reversed. Well, sorry, but you're going to have a hard time telling anyone that that was a decision that was based on health advice. A, because no one will show us this health advice, and B, how can the health advice then be flipped within 2 days and suddenly the resources appear? I'm sorry, I can only think it's just pure callousness. That's all I can imagine. There's so many examples. I could go on for so long. You know, in question time, we heard about the mother-baby unit in Gippsland that's lost funding. This is when women have postnatal depression or a mental health crisis, sometimes extremely sick, have to be hospitalised and can't be hospitalised with their babies unless they're in a mother-baby unit. But let's just cut the funding to that. And the minister goes on about maternal child health nurse like, that's a different subject, Minister. You must know that. And you've stopped that until March 12th anyway. So I just can't understand the callous behaviour that this health minister is responsible for. The Premier, as I say, he knows the system and he's absolutely callous.